It's worth supporting this bill.
Peter Aldous.
Thank you very much, Madam Deputy Speaker. I'm grateful to you for giving me the time. I would have liked to have spoken to new Clause 18 during the report stage, but this was not possible. Access to NHS dentistry is a problem that has been brewing for a long time, which has been exacerbated by COVID, and there are now parts of the country, particularly rural and coastal areas, where there are dental deserts, and it's invariably children from poorer backgrounds and vulnerable adults who suffer the most. The crisis is acute in Suffolk and Norfolk, but it is not confined to East Anglia. Sir Robert Francis, who chairs Health Watch England, commented, "Every part of the country is facing a dental care crisis, with NHS dentistry at risk of vanishing into a void." Madam Deputy Speaker, there are 5 issues that need to be tackled to address this problem, and this bill can provide the framework to ensure that this happens without delay and without prevarication. Firstly, increased funding must be provided. Secondly, it is vital that the new NHS dental contract, which has been developed for over a decade, is rolled out next April. There are rumours that it is going to be kicked into the long grass, and I would be grateful if we could receive clarification that that will not be the case. Thirdly, we need to step up the recruitment and retention of dental professionals. Fourthly, water fluoridation is important. It's important to highlight the role that water fluoridation can play in improving the oral health of future generations, and thus clauses 132 and 133 of the bill are to be welcomed. The final point, Madam Deputy Speaker, is there is a need for greater accountability and for dentistry to have a voice on integrated care boards and partnerships. In conclusion, Madam Deputy Speaker, at the current time, people are pulling out their own teeth. Children are having whole mouth replacements, and early signs of cancer are going undetected. We need to act now to put in place an NHS dentistry system that is fit for the 21st century, instead of reversing into the 19th century. The Minister has advised, my honourable friend the Minister has advised that the Government will not accept new Clause 18, and thus I would be grateful if, without delay, my right honourable friend, the Secretary of State, can ensure that his department comes up with a clear plan for addressing this crisis, which is affecting people all around this country. Thank you very much, Madam Deputy Speaker.
Bob Seeley.